the largest commercial and social coordinating point in the district, as well as for many regional activities in the north. Gulu Municipal Council lies approximately 332 kilometers north of Uganda, that is from Kampala City. The area coverage of Gulu Municipal Council is about 54.4 square kilometers. Gulu Municipal Council is centrally located in northern region of the country and serves as a regional town and hubs of economic activity in the region, including Southern Sudan and part of DRC Congo. To go straight to the guiding questions. The guiding question is how the COVID-19 crisis affected our finances. Gulu Municipal Council or Gulu District Local Government, let me say the whole Northern Uganda is unique in one way or another, in which Gulu Municipal Council depends or collect revenues from the business people. And those taxes that we collect is what we spend. And more so, we collect revenue in the third quarter. That is like we collect revenue in the, we use calendar year, not a financial year. So the best time for us to collect this revenue would have started in the third quarter, especially from March to May. That is where we could collect our revenue. But the coming of COVID-19 has affected it. There is now no revenue collection, which is taking place. One, because all the shops have been closed because of the COVID-19. The market where we could even collect money or revenue is mostly closed, but left with the only food vendors, those who sell food. And because of the government directive or the presidential directive or the World Health Organization directive, is that the distancing should be about 4 kilometers, about 4 meters between us, the distancing, the social distancing. So you find there are very few market vendors, women, men who are selling food stuff. So all our sources of revenue is affected. We cannot collect anything from anybody unless we are not normal with the condition that we are going on. Because the COVID came and got everybody unprepared. As you know, Gulu has been in the war for the last 25 years plus. And in between that, there was Ebola, which affected them so much. And when you ask us what measures have we taken to, as a local, with the COVID-19, it has not been a new thing, information of the task force. Gulu district, which is headed by the chairman LC5 and the RDC, when the COVID-19 issue came in, they had to call members, NGOs, local government, all the stakeholders to come and form a task force committee. We formed the task force committee in which Gulu Municipal Council is among the task force. It is not enough to form at a district level. They came to the municipal level where the mayor is the chairperson and many others. It went as far as being formed. The coordination committee is formed at the division level or the sub-county level to combat the COVID-19. So the formation is already there. The coordination and the task force is doing their work to see that we combat the COVID-19. So the formation is there, but the challenges are there. I have earlier on mentioned on the issue that Gulu is unique in such a way, or actually sub-region is unique, and Uganda itself that. We have been in the war for the last 25 years. So we were just like a child who is learning to sit or scroll. By that time, we don't have anything. When we have, as though we have formed the the task force of the coordination committee, we still have challenges in which we call for support from any international body that can help Uganda to fight this COVID-19. Because once it reaches Uganda or once it starts affecting our people seriously, we shall not manage because we don't have ventilators. We don't have anything. We have not equipped our hospitals, especially the regional hospital. It's not well equipped. So we call for the international body to support Uganda and even Gulu, especially, where it has been suffering for the last 30 years now as I speak. And then there is a question where you say, how?
Yeah.
What lesson have we learned?
To conclude,
yes, I'm concluding.
Very few words, please.
Yes. Now, what lesson have we learned? The lesson we have learned, we are aware that this COVID-19 and many other pandemics may come in. Because this is a new pandemic, we have not learned of anything, nothing is known about it. So the best thing now is to globally start planning for such a pandemic in future, long term, so that when such a thing comes, we have collectively, we have something to depend on, not just thinking now, it has come, what should we do, running up and down, as we are now doing, especially instead of running up and down, if we globally budget or have a strategic plan for that, it will help us if any pandemic may come apart from the COVID-19. And we should also continue planning because we don't know, this is a new pandemic. We don't know whether it gets cured forever. People talk of how many people has recovered and again tested positive at the end of the day, which is not good. We are not sure. We need to sit and plan, especially World Health Organization. They should really tell us what should we do and what is meant for our hospitals and what is meant for our health centers to reach so that we get ourselves prepared, not just taking us by surprise as COVID-19. Thank you very much for hosting me in this live learning session. May God bless you.